welcome again to the WHO Health Pavilion, it's the Health Pavilion hosted by WHO. You will know that we're running a very long series of events throughout the 2 weeks. Any health people here at COP or connected online, this is your home for the next 2 weeks. Please come in and partake of the amazing program that we have. And out of all of these events, we've just had our big UN system high-level event where we had presidents, where we had ministers, we had commitments on financing over in another room. That's part of the reason for the delay, is that we didn't want to intervene with that event. And that is all fantastic, and much of what goes on within the COP negotiations is fantastic. But I have to say that out of all the events that we have here, this is actually my favorite one. And if any of you are connected online or actually here in the audience, I can only assume that the only reason that you're here is because I haven't met you and I haven't told you this before, because I tell everybody about the Ride for Their Lives initiative and the work that's gone on with, I would say, an even more important audience and an even more important set of advocates for health than we have had in the other room with the ministers and the heads of government as well. Because the one thing that we know about communicating on climate change and health is that you need simple messages, you need them repeated often by trusted voices. The other lesson that I know on climate change and health is that almost everything that gets discussed here is negative. Almost everything is the impacts of climate change, the difficulties of accessing finance, and so on. And all of that is absolutely true, and we have to acknowledge that truth. But the one thing that we know motivates hope is action. And so this event that we're participating in is one that's very close to my heart, and it is one that is, as you will hear, is initiated by an amazing group of paediatricians and other health workers, particularly focusing on child health, centered in the UK, but also from other places from around the world, who basically, for everything, the amazing stuff that they do in saving children's lives every day, they also saw the looming climate crisis, and they wanted to do more, because they basically took the view that for everything that we do in the operating theatre or in the clinic, all of that effectively is pointless if we're not able to act on the environmental and social determinants of health, and that means climate change and it means air pollution. So very briefly, I'll give a little bit of the idea behind this. We and WHO are very pleased to support and participate in this event, have been basically cycling health messages. Took last year from Geneva to London, handed over to this amazing group who cycled it up to Glasgow, and as you'll hear, that effort has been repeated in more community rides from around the world. And we have some amazing participants who are connected online to tell you a little bit more about that event. It's also an absolute pleasure to have one of our favorite advocates for climate and health. I feel I have to sort of pay deference to her. This is the first ever youth envoy for a COP presidency. So it's the Egyptian youth envoy, the first ever. I'm also very pleased to say she's a friend of ours. She's a medical doctor from the International Federation of Medical Students Associations, is how we first knew her. And also in fact, she is our target audience for the kind of people that we want to deliver the message to. So that's what I wanted to say by way of introduction. Sorry, I'll make one more point. The messages have generally been carried around in a blue satchel. It's basically like a children's school bag. And that is the means we've taken to take the letters from healthcare workers, the WHO reports and so on these trips from around the world. It's signed by children who are patients in children's hospitals. And it's been carried by some of those children on their bikes. It was also signed by Dr. Tedros in Geneva last year, and by his daughter. So that is that's the thing we've been cycling around basically Europe and elsewhere to take this message. The idea was that satchel would be delivered to the COP presidency. It was cycled this year from Geneva to Napoli by paediatricians, and then couriered by UPS to be here today. And I have to say that's the one part of the journey that didn't work. So after having been cycled for 1,500 kilometers, UPS will be delivering this 1 day late. So you'll see it later in the conference. And I think my explanation for this is that this blue bag has got itself ideas above its station, and it basically refuses to go anywhere by plane. It feels it only can travel if it's being carried by a paediatrician on a bicycle. That's the standard it now has. So without further ado, by way of introduction, I think we have a video to play which will outline some of the background and some of the amazing people behind Ride for Their Lives. Last year, I cycled about 850 kilometers over those mountains behind me, the Jura, all the way to London, carrying a letter signed by organisations representing about 45 million health workers from around the world, calling for stronger action on the climate change and air pollution crises. In London, I handed that letter over to a group of amazing paediatricians and other health workers from the UK's National Health Service. They cycled about another 850 kilometres to deliver that letter to the climate negotiations happening in Glasgow.
Met some great people who hopefully will take the message back to their hospitals, their departments, and generate more enthusiasm.
And the kids have written all over the bag messages to the politicians. Wherever you want, whatever you'd like to say.
I think I can respond to this one. Listen to us,
I think so.
And I say we will.
I think so.
Okay.
I think that sounds perfect.
We must.
We must.
Nice.
El objetivo de esto es, lo uno, pues hacer ejercicio, integrarnos con nuestros compañeros y sin duda alguna pensar siempre en dejarles un mundo mejor a nuestros hijos.
I joined healthcare professionals at Ride for Our Lives, where they say unseasonable heat like this is part of a big problem.
I felt kind of daunted when I was putting together this bike ride that was 10 miles, having the motivation of knowing I was going to do it with the support of this group and we're all going to do it together was a real motivator for me.
I think it's really important for the healthcare community to come together because it's our frontline clinicians, the colleagues that I work with that are seeing firsthand the impact that this is having on people's health.
What we'd like people to do is to declare a climate emergency. They can sign the Fossil Fuel Non-Proliferation Treaty. It's a really important treaty that is showing that fossil fuels are a threat and that we can reduce their use.
We've got a real commitment as the Royal College to lead this work, to share good practice, to highlight the impact particularly of air pollution, but much more generally around climate change on children's lives.
On October the 18th, a group of health workers will be setting off from Geneva, and this time they'll be cycling over those mountains over there, the Alps, and a couple of them will be making it fully 1,500 kilometers all the way down to Naples in southern Italy.
Hello!
Hi.
I'm Ilaria.
Hi, Ilaria. You're a paediatrician, right?
Yes.
Yeah?
I'm exciting.
Yeah.
This road with you.
It's a beautiful road. I'm fairly confident that the environment up here is changing, and it's changing rapidly. It's changing too rapidly for lots of animals and plants that have evolved here. And it's doing that because we just cannot be asked to stop extracting fossil fuel from the ground.
We would have really liked to take the blue bag all the way to COP27 in Sharm el-Sheikh, but it's not possible for us to do that on our bicycles. So we'll be handing the bag over to WHO to take out to COP27 and to take the message not only of that we're trying to amplify and promote, but all the other people who've been working within Ride for Their Lives all around the world. We're united in the message that time is running out for our planet, and all the data and reports that have been published recently just kind of bring to the forefront how much we really have run out of time and we need to take action now.
Thank you very much for playing the video, and as somebody who hates the sound of their own voice, to hear myself broadcast at about 100 decibels by surprise was an unpleasant experience for me, but hopefully you got a sense of the experience that we're bringing, the voices that we're bringing. You've seen some of the great and the good of health, chairs of the Royal Colleges, editors of the British Medical Journal, the mobilisation of the health workforce as a whole. But one of the things that has brought this home is to actually actively engage in a positive action. And one of the other messages that I would say, I actually feel a little bit guilty when I talk about Ride for Their Lives, because I take time, I take leave to go and do that, and it's some of the best fun I've had. And so whereas we may be saying that it's arduous or it's a difficult journey or it's a difficult journey to decarbonise, one of the core messages I take away from this is most of the things we need to do to fix the climate crisis are actually really good for us, and I can't think of a better example of that than getting on a bike and walking to, riding to school or work, or going on a longer journey. So positive action is good for the person doing it as well as the wider community. So we'll be slightly compressed for time, and we have some fantastic participants who will be joining online. We also, as I've said, have a fantastic program of events. The next one is on mental health, so we think this is actually a very good setup to mental health. But I'll now turn to Dr. Omnia, Dr. El Omrani, just to give her perspective on, as a clinician, as a physician, but also somebody who is a passionate advocate on climate change, what this kind of active engagement means for you.
First of all, thank you so much for having me in this amazing demonstration of what the health community is capable of. Because for many years when I started advocating for climate change and learning about what doctors and the health community is capable of doing, that was when I was a second-year medical student. And I remember many of the students like myself did not see how we as doctors had a role in climate change, because it seemed to them that it is an environmental health issue, and it's a bit far away from what we do in terms of helping the patients and treating illnesses and diseases. But then when I started working more with my organization, the Federation of Medical Students, and then with the WHO, and many inspiring doctors, pediatricians, as well as nurses and health professionals who are so passionate around climate change, I started to understand that it is my duty and obligation to help my patients and treat their illnesses, but it's also an obligation to promote the health of my community, protected from the single biggest threat, which is climate change of the 21st century. And this speaks a lot to how it's also my responsibility to be the trusted voice for the climate movement, as a doctor, as a health professional who gets to see on a daily basis how this impacts the health of my people, as well as my generation, who are now suffering from mental health stress, worry, and anxiety about the future, and seeking the voice of us as a health community to push and work together with them to force our leaders to come to their senses and take urgent and practical actions for climate change. This COP is very special in Egypt, because we say that this is the implementation COP. We are kind of fed up of the slow pace of negotiations. We want to transform the commitments and the pledges of world leaders into practical solutions. And I see how a beautiful campaign like Ride for Their Lives, a message sent by pediatricians and doctors from around the world, coming right here in Sharm el-Sheikh, and really calling on the nations to not backslide on their promises, to place the health of our people, especially the younger generations, at the heart of the climate discussion and the climate agenda to deliver on the different aspects we are advocating for, to deliver on adaptation, to deliver on climate finance, to deliver for the first time on loss and damage. And the message behind that is really empowered by the health community. I know that there in the statute there's also the Fossil Fuel Non-Proliferation Treaty, because we cannot see further investment in fossil fuel that is killing our lungs and killing our dreams of a healthy future. And as doctors and as the health community, we are putting a strong voice to that, really standing together, elevating one another, empowering the health doctors, the health students, cycling, and really promoting the message of what we as individuals can do when you go back home from our countries, and how can we push for our nation's positions when they go at every COP, so that when we place the importance of health, the importance of climate justice, the importance of intergenerational equity at the heart of the climate discussions, we can see more implementation and more action on the ground. So I'm very happy to be here in what I call our health community and our health family, who has been pushing for many years. And every COP I see how our voice is clearer and louder, how negotiators are looking for our advice, how young leaders are seeking our support and our empowerment to their message of urgency and seriousness to really make us the last generation to face the climate crisis. So thank you.
Fantastic, wonderful. Thank you so much, Omnia. Thank you so much for being here. And as I said before, if we have one person that embodies everything we're trying to represent, health, climate change, youth, positive action and hope for the future, and actually getting that into the climate, into this building and the climate negotiations, you're the person. And we're so pleased to have you on our team. So if I can now go to the remote participants. We often say that health practitioners are the most trusted voices on the planet. I would say there's nobody that's more trusted than the people that take care of our children. That's, you know, when people are at their most desperate, is worrying about the health of their children. So it's a real pleasure to hand over to Dr. Camilla Kingdon, who is the chair, the president of the Royal College of Paediatricians and Child Health, and also a participant in Ride for Their Lives. So a couple of minutes from you, if I may, Dr. Kingdon, on your perspectives on this initiative.
Thank you very much for inviting us to take part today. I think, you know, the topics we're talking about can be deeply depressing, extremely worrying, and as paediatricians, you know, who advocate for children and who profoundly believe that climate change is a child rights issue, one can get very sort of depressed by it all. And medical royal colleges tend to be, in the UK, tend to be sort of institutions that like to spend a lot of time thinking about the detail and fussing about the minutiae. But this topic has really, really galvanized paediatricians, the length and breadth of the United Kingdom. And nothing epitomized that more last year than the ride from the cycle ride from London to Glasgow, and then this year with a number of rides happening locally. And so I think what we're trying to do is to say we hear our patients' voices, we hear the voices of our younger doctors who are increasingly worried about this. We want to show leadership in this area as a Royal College, so we want it embedded in our curriculum. We want it the message of climate change to be threaded through so much of our work. And so I think I'm privileged as president of the Royal College of Paediatrics and Child Health to you know, show some Royal College leadership on this matter. And you know, when I've got colleagues like Dr. Mark Hayden, who he sometimes describes himself as a thorn in my flesh. He's not at all. He epitomizes the energy and the accountability that I think paediatricians around the world, in fact, have. And he's great at sort of reminding me about areas that we need to focus on, and we need to work collaboratively in this area and give voice to children, because ultimately that is our role and responsibility.
Well, thank you so much, Dr. Kingdon, for those words. As effectively, as we would say, the boss of child health within the UK. It's fantastic to have your support and as an active participant. Thanks also for the setup to Mark, Dr. Mark Hayden, who is effectively the originator of this amazing initiative and my companion on some of these cycles. So I'll hand straight over to you, please, Mark.
It's great to have so many people here who've taken part, so I want to be really brief. But I think what Camilla just said is exactly right. It's our responsibility as clinicians to do something about this. The politicians aren't doing anything about it. The corporations aren't doing anything about it. The fossil fuel industry is continuing to greenwash and prevent progress at COP and other situations. If somebody's sick, as Heather said many times, we need to take away the cause. If the cause is fossil fuel extraction and pollution, we need to speak out about that as paediatricians. I'm an intensive care doctor. You know, if somebody is not going to survive, I need to tell them the truth about that, and the earth potentially is not going to survive. But we have a chance. We have all of the solutions. We have all of the things we need to do. We just need to do them. And I think that's really what Ride for Their Lives is all about, listening to the World Health Organization, listening to the Royal College of Paediatrics and Child Health, which tells us this is our duty as paediatricians, clinicians, all sorts of healthcare providers, and using the action of cycling together and talking about this to achieve that. So if there's one thing I'd like to say before I stop, please, everybody, if you're a healthcare provider, sign the Fossil Fuel Non-Proliferation Treaty. I'm pushing Great Ormond Street, where I work, to do so, and I think they're going to do it. I think all children's hospitals across the world should be signing this. It's a basic minimum requirement for what we're putting on the table about what needs to happen. It's our job as clinicians to tell the truth. I'm going to stop there because there's many other people who can speak much better than I.
Wonderful, thank you. Thank you so much, Mark. And one of the lessons I take away from dealing with paediatricians and with frontline health workers is that they tend to cut through the nonsense. There is none of the faffing around that we may hear within UN negotiations. And the fact that it took us, I think, until COP26 to actually mention fossil fuels. You wouldn't get that in an operating theatre. You wouldn't get a child coming in sick and, you know, with lung cancer and saying, well, we don't want to tell you what's caused it. We don't want to intervene. It's like talking about AIDS without saying it's caused by HIV, talking about COVID without saying it's caused by the virus. So thank you for that clarity of message that we do need to get off to break our addiction, to use another health metaphor, to fossil fuels and the call for the Fossil Fuel Non-Proliferation Treaty. Thanks very much, Mark. If I can now go to Clare Scully, who is the Director of Healthcare Insight at Bupa, if we have you online, Clare, and of course one of the supporters of Ride for Their Lives. So over to you for your perspective, please.
Thank you, Diarmid. And look, I'm so honoured to be here today representing my crazy and brave colleagues at Bupa. Together we cycled about 110 kilometres from London to Brighton last month, and we were sharing stories across the UK healthcare sector around healthcare and the interplay with the environment. For those of you that might not know Bupa, it's an international healthcare company. It's got 38 million customers around the world, everywhere from the UK, Australia, Spain, Chile, Poland, other places too, offering everything from insurance to frontline hospital, dental, clinic and aged care services. And I have to say, you know, as I've come into this over the last year or two, I've been so impressed about how the healthcare community has become more vocal about the health arguments for climate action, everything that we've just been hearing from Camilla and Mark. And I'm really proud to see that Bupa has been supporting Ride for the Lives for second year in a row. You know, personally, I have to admit that this year was the first time that I'd done a cycle ride anywhere near this size and scale. And so it felt pretty big ask for me. I felt pretty scared before we set off on the ride. But I have to say the level of support that I got from every single healthcare facility we stopped at, and there was a real spread. We went to dentists, we went to primary care centres, we went to hospitals, we went to care homes. It was just phenomenal. There was that sense of collaboration, that everyone involved was taking that chance to encourage each other, and that by working together, we could make an impact that none of us could achieve alone. And that was certainly true for me, taking on that distance. There's no way I could have done that without the support of everyone on that ride and all my ride buddies. you know, I know within our own Bupa team, all those riders have left with a real renewed sense of commitment, and we're now developing a network of sustainability champions across the business. There was one other thing that really struck me on the day, and it was when I was chatting with Mark and talking to him about his blue satchel that was strapped to his bike. And he said to me, look, everyone that's involved in these rides, they come away on a high. They've got this sense of camaraderie, they've got this sense of purpose, and they must use that sense to drive this agenda forward. And it was something that really resonated with me. It made me realize personally that I can make far more of a difference than I ever thought I could, both in what I say and what I do, and also really remembering that storytelling, which is, I think, something that Ride for the Lives does really neatly. It makes a really complex and incredibly important message accessible and easy for people to relate to. You know, I'm really aware that not everyone cares as much as we do about climate change or air pollution, but everyone cares about their health. Their own health, the health of their families, the health of their friends, the health of their communities. And I think that's where our power and responsibility as healthcare professionals lie. So, yeah, it really resonated to me, Dem, and what you said at the beginning about we need simple messages that are said repeatedly by trusted voices. And, you know, that's really the big thing that I've taken away from my involvement with Ride for the Lives. So thanks for having me on here today.
Wonderful. Thank you very much for that intervention as well, and for making clear this. It's also it's a big family as well. It's private sector, it's public sector, it's frontline health workers and so on. But we're all on the same mission. So thanks very much. I'll have to apologise again for having to start this meeting. This session late. We are constrained at both ends of the programme, so we'll be running up to about 5 minutes over, but no further. Partly because we have a really interesting session on mental health coming up, and we think the two topics are very well linked. At this point, it's a real pleasure to go to Dr. Heather Lambert, who's also one of the absolute champions of the cycling part of this. If I can see your background, Heather, it's probably up a mountain somewhere on a bike. And over to you, Heather, for a few words on your experience as well.
Thank you very much. Thank you so much. It's a great honour to be invited to this meeting. I agree with everything that's been said, that as a paediatrician, I've got a moral, ethical and professional obligation to speak up about the harm that's being done here and now and the urgent action that's needed. You can see behind me there's the glacier. I cycled up this valley yesterday to the base of the glacier, and you can see that the glacier is receding. And yesterday evening in the restaurant, I was looking at film of the flooding that came down this valley in July. The effects of the climate of global warming are here and now, and we need urgent action. It's been an absolute privilege to be riding with Ride for Their Lives. If anybody thinks that riding 1,500 kilometres with these guys that you can see on the video is difficult or a challenge, it's just been an absolute pleasure, and the conversations I've had with people have been phenomenal. And the conversations I've had with these amazing people have really challenged me to kind of evaluate my role in what I can do. And I think three things that I now kind of know, having really thought about the stuff that I care about. Firstly, that the climate crisis is inextricably bound up with climate justice and with the injustices of the world. And we can't talk about climate injustice without looking at the other injustices in the world and trying to solve those. Secondly, I think people really do care about health, and people care about the health of children. And I think we have to, every time we talk about climate crisis, we've got to link it to health, because that is what people care about. And I think lastly, it doesn't really matter that I'm not a climate change expert in any way at all. My role is to learn as much as I can and just to amplify and repeat the messages from reliable organisations like WHO, and get those clear messages out repeatedly. So thanks for having me along.
Wonderful. Thank you so much, Heather. And if you really want a climate advocate, David Attenborough's great, but stick a paediatrician up a mountain in front of a glacier. That's the way to do it, because they can make the connection between that glacier and children's health and the lungs in this amazing installation behind me. So thanks so much Heather, for all that you do for this wonderful initiative. And to continue quickly with our whistle-stop tour of the world and these amazing participants in this initiative. Can I just check we have Dr. Ilaria Mariotti online as well, also a paediatrician from Modena, and one of the people that was connected into the to the ride as well, and I think featured in the video that we've just seen. So over to you, Ilaria, for a few words.
Yes, thank you. I will be very quick. Thanks to everybody. I'm a pediatrician in Modena, and I met Heather and Mark. I rode with them. For us, Ride for the Lives company was very important because also in Italy, we organized a flash mob the 6th of November, and many pediatricians rode with us in Rome, Milan, Turin, and we have the event was featured in newspaper and television with quite a big prominence in local and national press. And that's for us is important because every day we see in our work how child health is on danger, and we have a lot of environment-related disease. So we want to tell people, parents especially, and family to change the behaviors, and we have to do it now, because we cannot only dream beautiful nature or blue skies, rivers full of water. We must change ourselves and I'm sorry. Okay, and we must follow what we are saying today, everybody. A lot.
Wonderful. Thank you again so much, Ilaria. And again, there was a word in there which I picked up on, which had been missing up until now. You mentioned mother. And if there's one audience which is, or one set of advocates that's even more of a passionate and empowered advocate for action on this issue, it's the people that turn up with sick children, wanting their children to be taken care of. And that's also part of the connection that we're making as well. So thank you very much for those comments. So just in the last, the extra 5 minutes that we've been granted, if I can turn to the last two panelists that we have remotely. So Claudia Lorena Paz, who works for Healthcare Without Harm in Colombia and organized a ride in Latin America. Thank you, and you have the floor.
Hi, good morning. Thanks for having me. Well, thanks for inviting me to tell my history. So just to know, last August, Healthcare Without Harm partnered with Climate Acceptance Studios and the Global Climate and Health Alliance to host a regional webinar for the launch of this year's edition of the Ride for Their Lives. Several rides were organized as a result, including the one in Cali, which I participated in my personal capacity. So when we learned about this initiative, we decided to do it in my city, in Cali, in Colombia. And the perfect day was the day without car and without motorcycle in September. And we called other institutions, and of course we called some global green and healthy hospitals in my city, in Cali. All these actors were very receptive. The experience was very wonderful. It was almost 6 kilometers, more than 20 people. We had even veterinarians in the ride. And this not only inspired, but also created new motivations to continue working on reducing the climate footprint, and especially in caring for our health. And I want to highlight a key message that came from our participants, and it's the climate change is one of the gravest challenges that humankind has ever faced. This crisis presents a threat to our health and well-being, but also present an opportunity to take action, climate action.
Wonderful, thank you so much, and thank you for spreading the reach of healthcare, of the Ride for Their Lives and the partnership with Healthcare Without Harm. Although it started off as a brilliant idea in London, it's really important that the representation and the inclusivity of this, including in parts of the world which are even more affected by the climate crisis than Europe and North America. So the final intervention is from Chelsea Cooper, who is the student representative for Montana Health Professionals for a Healthy Climate, and who organized a ride in what sounds like absolutely beautiful environment in Montana. So over to you, you have the floor.
Hi, thank you for welcoming me today. So I am the student representative, again, for Montana Health Professionals for a Healthy Climate. I'm a PhD student in public health, and we have a student chapter of that organization on the University of Montana campus. So it was actually a group of students that organized this bike ride in Montana. And the reason that we did this is that our club is committed to drawing attention to the inextricable links between climate change and human health. All the local actions we do are focused on drawing attention to those links. And so we thought that the bike ride was an excellent opportunity to do that in our community. Air pollution is a particularly pressing issue in Montana because of wildfires in the Western United States. And in Missoula in 2018, the American Lung Association actually gave a failing grade to Missoula for its particulate air pollution. So it's critically important to be providing education that draws those links between climate change and human health. It was a really excellent opportunity to have interprofessional collaboration, but also intergenerational learning, because we had health professionals who are out in the field that participated in the bike ride, as well as students who will soon join that workforce. And the conversations that we had around the 3 pillars of sustainability really led us to the conclusion that we needed to bring more educational efforts to the University of Montana campus. So next semester, our student group is organizing a panel discussion that will focus on raising attention around those links between climate change and human health, but also specifically the impacts of the healthcare sector. And I'm here representing my student friends and colleagues, and a message that we really want to send is that students are a passionate and committed resource in raising the voice of the healthcare sector in the fight around climate change. And we thank you for letting us participate in this. So thank you.
Wonderful. Thank you so much. And that's a really a good note, I think, to end on. Basically, I would say that the pleasure and the motivation that comes from participating in this and mobilizing your community to work around this issue. So I'll just bring the session to a close. Apologies to the next session for overrunning by 5 minutes. I'm actually going to claim the 5 minutes because one of the messages that we wanted to get across from the Ride for Their Lives is the positive mental health benefits of actually acting on the climate crisis. It's partly through physical activity and getting on a bike and so on. There's nothing that puts a smile on your face quite so much as getting on a bike, I would say. And it is one of the lessons that we want to drum home within the climate negotiations, that although doom and gloom is everywhere, the one thing that we need to have is hope, and hope only comes through action. And that's the mental health message that we wanted to pass on effectively to the next session.